Welcome to the Body Talk Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the biceps brachii muscle. The biceps brachii has two heads, and it goes from the supraglenoid fossa. So there is a labrum, which is a cartilaginous cup that holds the upper arm bone, the humerus, and the upper portion, the long head, is going to attach to that. That's in the shoulder joint deep. And it's going to then run all the way into the radius, which is the bone that is responsible for the rotation in the forearm. That's going to be the long head of the biceps. The short head is going to go from the coracoid process, which is a bony prominence or bony structure that's on your shoulder girdle, the scapula, and it's going to run down from on the inside. So we've got the outside through the bicipital groove or the intertubercular groove. You're going to have the long head of the biceps, and that's going to run down, and then the short head is going to attach to the coracoid process and run down through the inside. So if you've got trigger points in your bicep, you may experience some upper anterior shoulder pain, or you can have pain in the cubital fossa, right at the elbow, right in the front. So it is not uncommon that if you have a tear in the labrum, that the biceps is involved because of the attachment to that cartilaginous cup in the shoulder. So, and there can also be an injury where you can rupture the biceps tendon, and then that bicep then is going to curl up, so to speak, so it has a Popeye appearance to it. So if you have injured or hurt your biceps, you've done any heavy lifting and overstrained the biceps in that manner, if you do heavy loads with a flexed arm, or repetitive elbow flexion, you can develop trigger points in that bicep. To release the trigger points, I'm going to use a single lacrosse ball, and I'm going to go along the muscle belly. So I will go just down a little bit lower. I'm going to find my muscle bellies there, and I will keep my arm relaxed as I do this, and then I'm going to apply pressure along that region. So I'm going to go down, investigate where I find any tenderness, and then once I find a trigger point, which is usually tender, I'm then going to go perpendicular to the muscle. So I'm just going to hold and slowly move across, back and forth. So I am going to move perpendicular to the muscle belly. And I'll just hold that. You can hold the pressure 20 to 30 seconds and then continue to move along, investigate, mobilize the fascia and the muscle. So working on that bicep, and I spend about 2 minutes on the connective tissue as well as the trigger points in the muscle, those over-contracted areas. You may feel referred pain up into that upper anterior portion or the front side of the shoulder, as well as pain referred down into that cubital fossa or the front of the elbow region. And that is indicative of a trigger point if you are experiencing that referred pain. So once that tenderness or the referred pain starts to subside, that's a sign of an effective release there. So you just can work on the muscle to get that release, and then I will stretch it. To stretch the bicep, so the action of the bicep is the flexion of the elbow, but also when the elbow is bent, it's going to supinate. It'll turn the forearm or turn the arm up. So it's a supinator as well as an elbow flexor. To stretch that, I'm going to go into pronation and elbow extension. You can go right to a door frame or find an edge. I'm going to keep my thumb facing down and my elbow is going to be straight. I keep my arm in line with my shoulder. So I've got my position of my forearm and my elbow, and then I'm going to rotate my torso away, and I should feel a stretch right through that bicep when I'm in this position. I can hold anywhere from 30 seconds to a minute to get a nice effective stretch. That's just going to help restore the muscle tendon relationship. So I have then reset those muscle spindles in the muscle and stretched to restore that length tension relationship, and that may help to reduce any of pain that I may experience in the front side of my shoulder or in the front side of the elbow if that is where I'm feeling discomfort and it's coming from the bicep. I hope this is of help and have a blessed day. Thank you.